And good afternoon out there. Welcome to WDTN.com for this live webcast. I'm Mark Allen.
And I'm Marcia Baumhart. You can participate right now. Use the live chat at WDTN.com to ask your questions.
Now, clearly a lot of ground to cover today. Our goal, though, is relatively simple, to try to help you better understand all of the reform proposals and their potential impacts. And we feel, quite frankly, that this commercial-free venue is the best way to accomplish that goal.
We're going to start now with a look at today's key developments in Washington, D.C. Right now, the Senate Finance Committee is back at work on the Baucus bill. We will break down the details for you in just a minute. Tuesday, hearings ran for 13 hours as Democrats and Republicans wrangled over 565 amendments to that bill. They voted on one, a pilot project that allows doctors to monitor Medicare patients electronically. Baucus wants the bill through his committee by week's end and plans to make $50 billion in changes. Those include sweetening subsidies for low-income people and reducing penalties for people who refuse to buy health insurance coverage.
And then right outside those hearings, a key health care reform rally hosted by college coaches, including former UD Flyer basketball coach Oliver Purnell, now at Clemson. He and several other coaches told American Cancer Society activists they want to guarantee health coverage for everyone, regardless of any pre-existing conditions, and require minimal or no deductibles for cancer screening procedures.
Those are the latest headlines of this very complex issue. We understand it can certainly be difficult to follow.
And that's true of you as well of us. One of our goals here today is kind of be a translator for you, breaking down the plans and all those buzzwords you've been hearing and the many points of view so you can clearly and precisely make up your own mind. And the poll results we got last Thursday reaffirm the value of things like this webcast. In our exclusive 2 News web poll, we asked this question: how well do you understand the competing health care reform proposals? Well, 47% of you out there say you do not understand them. 24% say you somewhat understand, with just 20%, 1 in 5, rating your understanding as very well. 9% of you say at this point you simply do not care.
Now, those poll results make it clear that a lot of people do not understand the health care reform plans that are on the table. So here's a brief guide to the 3 key proposals before Congress right now. The newest reform plan came out just last Monday. Montana Senator Max Baucus emerged from nearly a year of committee meetings with a bill that carries a $774 billion price tag. It's missing a public option, a plan to have the government administer health care, but it includes seed money to create membership-run cooperatives. It also includes a requirement that insurance companies cover everyone regardless of their health status. And it mandates employers with more than 50 employees to pay a penalty if they don't offer health insurance. It's paid for with $500 billion government health program funding cuts and some new fees and surtaxes. Also from the Senate, a second bill, one that costs $645 billion. It does include a public option, requires everyone to buy insurance, requires employers to cover their employees, and prohibits insurance companies from refusing to cover people with pre-existing health conditions. The House health care reform bill is the most expensive, more than $1 trillion. It includes a public option, requires every individual and employer to buy insurance, and bans coverage rejection based on pre-existing conditions. It's funded by surtaxes on some of the wealthiest people. Now, there are 2 other concepts on the table. One is by the President, which is a list of 8 guiding principles for health care reform that he outlined in his speech to Congress September 9th. Many of those are in the bills I just described. The other is a Republican plan outlined in the House. It carries no price tag, contains no public option, and does not mandate coverage by employers. It calls for a reduction of Medicare and Medicaid waste and fraud, but also calls for more access to health care for everyone.
And as you well know, if you've been watching the coverage, the political battles over reform have been loud and contentious. The lawmakers who represent many of our viewers are very clear, though, about where they stand on the issues. Here's a listen and look at some of what they think.
Certainly there are things that we can do, and efficiencies and waste in the system. But so far, even independent analysis of the bills that are going through the House and what the President has supported has indicated that the cost savings will result in lower care, lower accessibility, and still increasing deficits on the federal side. You know, the President is quoted as saying, having said himself, that when we have an elderly patient that perhaps they don't need a new hip, perhaps there are other treatments that could be provided. That's not a decision that I think that the federal government should be involved in.
I'm listening to my constituents in my district, and I hope other members are too, because what I'm hearing in my district is that most people are opposed to a government option or a public option in this health care program. They don't want government administering health care, telling them what doctors they have to choose from, or what insurance companies they have to choose from, or what treatment they have to take. They want to have that choice, and they don't want government administering health care.
Well, we need reform. I think every single American, every family, every small business owner understands that. But Americans don't like this idea that they've seen Congress work on here the last several months, this federal takeover of health care. And they don't like it for a fundamental reason. You think about Americans, we hate being told what to do. I mean, we just hate it. It's why we're Americans.
Small business is a centerpiece of this, helping small business provide health insurance for self-employed people and for their employees in small business generally, is a centerpiece of what we need to do in healthcare. First of all, anybody that has health insurance can keep it, but they also will get consumer protections built around that health insurance. No more pre-existing condition exclusions, no more discrimination based on gender or age or disability. There will be insurance offered for people without insurance at a reasonable cost for quality insurance, and small business will get incentives to be able to buy insurance through tax credits and all that, and go into a larger pool, which will keep their costs more in check.
And Senator Brown also told us that he does not think that he would vote for a bill if it does not include that public option you've heard so much about, because the enforcement arm would not be strong enough to prevent insurance companies from dropping people with pre-existing conditions or capping coverage. Marsh?
Now, beyond the plans are those buzzwords that dominate this debate.
We have heard them over and over. Marsh and I, other journalists, have said them repeatedly, but do you really know what they mean? Well, let's bring in at this point our third moderator for this webcast, Kenan Oliphant, our consumer reporter, who's going to help answer some of those key questions. Hello, Kenan.
Hey, how you doing, Mark and Marsha? If you listen to this debate long enough, you are sure to hear words and phrases that sound like a foreign language but are pivotal in this debate. I went to the streets of Dayton to see if people know the language of reform.
Robert, tell me, what is a public option?
I think I have a thought as to what it is, but I'm not sure. It's a place where folks can buy health insurance that's not from a private insurance company.
When they say public option, what is public option?
Public option, option to choose what you want.
Public option, we hear that all the time. Do you know what public option means?
No, I don't. I think public option, to me, is we got a choice of either going with our workplace or we can go and pick up a coverage elsewhere.
Do you know what a public option is?
I do not.
When you are looking on the news and you hear a term like public option, do you know what public option means?
Nope.
Can you tell me what a single-payer system is?
No, I cannot.
Do you know what Congress means when they say a single-payer system?
No. Single payer would be if we could all go out and buy the same thing like the Congress is buying at a certain amount.
When you hear a term of single-payer system, you know what that means?
Nope.
Can you tell me what universal health care?
There's coverage for as many people as possible, I think, but I'm not sure.
And tell me what universal health care is.
For everybody? That's what I'm guessing. All right, universal health care.
What about universal health care?
Is that a company?
Do you even know what a co-op is? Or when you hear something like Cadillac plan, do you know what that is?
No.
So basically, when the president, Congress, they get on TV and say, hey, we want public option, single-payer tax system, you have no clue what they're talking about.
None whatsoever.
And that just seemed to be a lot of the thoughts on the people on the street that I ran into. So how many did you know? I say the average was about 2 or 3. So let me translate some of the key terms in this health care reform debate. First, public option. also called a government-run plan. It would be a policy offered alongside private plans. Next, the single-payer system, put simply, is a system in which one entity, presumably the government, would arrange payments for everyone's medical care. And next, universal health care. Simple. A system in which everyone has medical insurance. Then there's co-ops. Translation, well, they are nonprofits owned by their members that compete in the marketplace for affordable insurance plans. They are not government owned. And finally, exchange. That translation there is a marketplace in which individuals shop for insurance plans overseen by the government. Plans in the exchange would be subject to approval by expert panels. These exchanges could operate at the regional, state, or national level. Now, I hope that helps clear some of those things up for you. You want to keep those phrases in mind as you watch this webcast. By the way, I want to hear from you about the healthcare reform. Join us right now, live chat at WDTN.com. You can also communicate with me on Twitter and Facebook. Already have gotten a couple of comments. One from Michelle Williams on Facebook. She says, being a former healthcare worker for the last 20 years, I can tell you if we don't do something to get insurance companies and medication costs under control, none of us except the wealthy are able to afford health care. The big question here, what do they propose about the escalating cost? And don't they think getting everyone insured will decrease health care costs in the long run? After all, it's reported that a big part of the cost is due to the uninsured. Mark and Marsha, I'm sure that's a good question for your next guest.
That's for sure. Thank you, Kenan, very much. And also, thanks for that question from Michelle Williams. We begin breaking down the reform issue by welcoming our first guest.
Our first of many guests. We have a very impressive lineup for you this afternoon here on WDTN.com. But at this time, we are very pleased that Lisa Hackley from the Ohio Association of Health Plans is live here to join us. We certainly welcome you. Lisa, you've seen the plans. You've heard the debate, the arguments happening at town halls all over this nation, all over this town. Give us, I guess, here initially the insurance company's perspective on these, on just the general idea of reform.
Sure. Thank you so much for having me. I'm so happy to be here. The America's health insurance companies came together about a year ago and did their own town hall style meetings across the country to listen to consumers' concerns, medical providers' concerns, and come up with some ideas for reform of our own industry. And that sometimes gets lost in the heated rhetoric and debate, but the insurance industry has suggested reforms on itself, including getting rid of pre-existing conditions, making sure that everybody has coverage, and you know, things along those lines to make sure everybody's covered in the system and nobody gets left and goes through the cracks.
So you've been proactive. You're not just sitting back and waiting to see what happens.
No, definitely not. And our industry has run commercials supporting bipartisan reform, has been a part of the dialogue on Capitol Hill, and will continue to be.
And as we just heard with some of these proposals in reference to pre-existing conditions, my first question is, are insurance companies really willing to extend coverage to people with those conditions as a price for securing the broader consumer base that would certainly result from mandatory coverage? Is that going to happen?
Yeah, that is something that the industry has proposed for itself, to eliminate pre-existing conditions, exclusions for gender, as long as everybody's covered. Everybody's got to be part of the pool in order to make it work.
It is interesting, too, to sit here and watch these comments come in. I know Kenan's keeping a close tab on these, but we appreciate you folks out there chiming in, and we'll get to some of these as we can. But let me ask you about the public option. I mean, we're hearing so much about that. It's been a big topic this week in the committee debates, the Senate Finance Committee, as they kind of pick this thing apart. From your side's perspective, your thoughts on this public option?
Well, we have concerns about the public option, mainly because the government would be setting prices and would set them, you know, if they set them at Medicare rates, they're already lower, and that would force some companies out of, you know, potentially out of business and people out of their insurance coverage, because the government would set prices at the public option level, and it would be impossible to compete with that.
Okay.
Those folks who are talking about public option, they're saying that it would create a vibrant marketplace that could really create a lot of competition, which would be good.
Because the theory, of course, being the competition would set the price. Would competition, generally speaking, in a capitalistic society, is a good thing.
Right. But if you have the government setting the prices at an artificial level, then, you know, there is no real competition.
Lisa Hackley, thanks so much. And Mark, are you going to set up a soundbite with Senator Sherrod Brown?
Right. Let's do that. Okay, let's go to that right now. Senator Sherrod Brown.
You know, I hear insurance companies always make fun of government, saying government can't be efficient, can't do anything right. What are they scared of in the public option? That it's going to be so efficient it's going to put them out of business? I mean, the public option will, you know, I think what the public option does is maybe what happens is insurance company CEOs no longer make $20 million a year because they got to compete with a Medicare-like government option that people can choose one or the other. And I think that competition will make the insurance companies better and will make the government option better.
And if there are no public options, what about co-ops or exchanges?
Well, co-ops are also an untested idea, and there would, as they're written now, be government, setting of prices. So that would also be a difficult thing to compete against. To what Senator Brown said, people don't realize that the insurance industry employs their friends and neighbors, including here in Dayton, in the Miami Valley. The average wage of an insurance job is between $42,000 and $50,000, and insurance companies employ about 15,000 workers directly, with another 35,000 employed indirectly. So it's an economic engine also for Ohio, which I don't want to have overlooked.
No, clearly, with employment being the issue that it is here locally right now, that's certainly a valid point. Let me ask you one more thing about the idea of universal care that we talked about earlier, where everyone is required to have insurance. I like the comment from Jim Jordan earlier saying that Americans, we don't like to be told, what we have to do.
Right.
What are your thoughts on universal care?
Well, that's the way it's going to, the way the system will work is everybody has to be covered, everybody has to participate, and that way the risk will be spread. I mean, that's the whole basis of insurance, to spread the risk instead of just having mostly more elderly or sick people in a pool. That will spread it out with healthy and not healthy individuals to spread the risk.
Gotcha.
Thanks so much. Lisa Hackley from the Ohio Association of Health Plans. Thanks for being with us today. We're going to send it back over to Kenan and see what the viewers are saying right now.
I'm tracking the feedback on our webcast through our live chat at WDTN.com. That's where I want you to go. Tell your friends, families. Come here, WDTN.com, chat about this health care reform. Don't forget you can reach out to me through Facebook and Twitter. I want to head right to our Cover It Live web chat, where we have been getting some great comments and feedbacks so far. One from Diana Browning. I have the health care reform screen that says live streaming. Would any of these bills, if when passed, be effective before 2012? So as to be the benefit now to those of us who have been laid off. One from George. George says, yes, we already pay for the sick. That takes away a common argument for government takeover. What we must do is make the system more affordable and more efficient. Keeping the government out is the best way I think of it. And the last one from one of our web people is, if the bill passed, it will just add to the unemployed. So those are just a couple of comments. Mark and Marsha, right back to you.
Thanks, Kenan.
Yeah, they're really coming in.
That's for
Fast
sure.
and furious. So yep, keep it up.
We continue our investigation of health care reform with two local physicians on the front lines of the issue.
Certainly they have a big stake in this, joined right now live by Dr. Paul Gresham over there next to Marsha, and to my right, to your left, Dr. Alonzo Patterson. We certainly appreciate both of you gentlemen coming in today. So let's get right to one of the hot issues in this. Again, that public option. There seems to be some very firm lines, drawn when it comes to that. Paul, let's start with you. Your thoughts on that?
Well, I think a public option probably is not essential. Anything that can get the costs of health care insurance down and provide more competition for insurance companies to get the costs down. The rate of rise of health care insurance has been 120%. I'm a council member in the city of Centerville, and our rates have gone up 120% in 10 years that I've been on council, and that's unsustainable.
And that's pretty common. That's not just Centerville. That's pretty much across the board in any business.
One of the reasons for that is health care. And so certainly any option that will bend that cost curve, and personally I think a public option is a good idea, that it would do that. It would give the insurance companies some competition. 28% of every health care dollar that's spent on health care insurance goes to administrative costs and not to health care. So something's not working right.
All right, Dr. Patterson, your thoughts on that?
I feel we've always had public options in health care. My father has often told me when he's getting older, he was a veteran, so he can still have health care through the Veterans Administration. We've insured our troops. We've insured people in Congress who served in all sorts of civil capacities as well. And families are choosing public options now. I have a lot of my parents who have Medicaid products for their children because by income requirements they qualify, but they have health care insurance purchased through their employer for themselves, but they can't afford coverage for the whole family. So we're already having public options that people are choosing from. And so one that coordinates what we're doing a little better to get overall costs down, to help balance out some of those large incomes that some companies are making from insurance premiums, and the way we go about insuring people now would help to bring down the cost of health care. And that's really what the whole goal of it is over the long term, is to contain that cost so everyone can afford to take part in it.
Between the two of you, which of these options would you prefer?
A combination of many. I think that the time is past for us to stay stuck in one spot and figure out what we can take best from one proposal and one argument and try to bring together to move things forward.
So of the 4 or 5 out there, you're saying there needs to be a mix. There's not maybe one specific one you love at this point.
I think people need to stop standing in their foxholes and shooting at each other. and they need to start figuring out how we can work these things together. I understand that.
They need to come together. You know, there are good points in all the plans in Washington, and I think the House and the Senate need to pass their versions, and then they need to get together and conference on it and come up with one plan and do something. Our country's been talking about this since Theodore Roosevelt, and nothing has been done, and it's now come to the point where it's a crisis. People cannot get health insurance. I cannot insure the people in my office, the workers in my office. We've been turned down for health care insurance.
And you're a doctor.
And I'm a physician.
You guys are on the front lines of this every day as physicians. What, from your perspective, is so broken? What is so wrong with the current system? What maybe the first 1 or 2 things that you'd like to see fixed?
I think that how people have gone about accessing the system and how the system has grown up in a sick care system. We've placed more value in our system on taking care of illnesses and doing procedures than we have on really caring for our health and valuing the advice that helps people to move forward in a healthy fashion throughout their lifetime. I think that we have to retool a lot of health care to truly have reform, and that includes our ideals of what is healthy and how do we stay healthy.
And Dr. Asham, I'm sure that all doctors, certainly your primary interest is those who are uninsured. So how can this, what can you do in terms of how this can help?
As far as people being uninsured, I think,
because your instinct is to help.
Is to help, and to take plans, to take Medicaid, patients who are on Medicaid, even though you may get paid a little less to do that, is one way you can help. And people who are self-paid, to offer them some discounts or other ways to get health care.
It's a tough spot because you guys take the Hippocratic Oath. I mean, you swear that you're going to do everything you can to make people healthy, and then you get all the red tape involved. It's a tough spot. So, Drs. Patterson and Gresham, thank you very much. And we'll have more doctors to hear from coming up. But right now, let's kick it back over to Kenan, who is trying desperately to pick up on all of the tweets and chats and everything else. Kenan, how you doing?
Mark is coming in fast and furious over here. I want to remind you to keep the feedback coming about our webcast. If you have something to say, join our live web chats at WDTN.com. I just got some feedback from Shannon Miller on Facebook, and she asked how this bill will impact nursing care. Will there be rules to protect patients related to nurses to patient ratios, which at this time are not governed outside of California? And in parentheses, she says, I think they are the lone state with these rules. Also, We are in the midst of nursing and physician shortages, she says. What if any provisions have been made to address this, given to the entire country will have access to health care? Well, Shannon, that's a great question, and we have another set of physicians who are up next that will be able to answer that question and might share your concerns on this issue, since patients depend on hospital staff to keep them alive. The same question was posed when I hit the streets of Dayton to see if people understood the health care reform terminology. One Wright State student told me she's a future doctor. She just simply wants to know if she's going to have a job to pay off that massive student loan bill. Mark and Marcia, back to you.
Some things to be concerned about. We continue with health care reform with 2 additional physicians.
Joining us now, Dr. Margaret Dunn, President and CEO of Wright State Physicians, right over there. And right next to me is Don Wynn. He is a pediatric urologist and State Director for Doctors for America. Welcome to you both as we continue our discussion here live on WDTN.com. Dr. Wynn, you have been, let's say, critical of health insurance companies. What is wrong with the way the plans work now as far as the way they affect both doctors and the patients that you're trying to take care of?
Where do you want me to start?
Wherever you'd like, sir, at the top.
You were talking about taking the Hippocratic Oath. When I took the Hippocratic Oath, I realized that when I tried my best to take care of my patients, and then there's a group of individuals that are not doing the same thing, that are actually trying to do the opposite. Not all of them, but some of them. And that really goes against what my belief is. And this is why I speak out and for the patients. When I go to bat for the patients, they realize that I'm the physician who's trying to take away the middleman, so to speak, the people that stand between me and the patients.
Have there been instances where you have not been able to do what you think was medically necessary for a patient because of insurance pressures or red tape or government? Or
I belong to a special group of physicians that are surgeons. And so when we do surgery, and in fact, this whole debate on healthcare reform centers mostly around primary care physicians. Those are the groups of people that are on the front line.
First people you see when you get sick.
Exactly. But as a physician, as a surgeon, and there's a reason why surgeons don't speak out so much, because the system rewards surgeons and procedures. But I'm speaking out because you know, when I see patients that disappear, for example, because their insurance policy has been dropped and they don't reappear for 2-3 years later, and then you find out that they basically just cancel the surgery because they don't want to have the surgery, they cannot afford it. Or letters of necessity that I have to write for the procedure to be paid for.
Your thoughts on this?
As the head of the university faculty group, we spend an enormous amount of time and resources in the number of employees we have to have and the sophistication of the software we need to have to submit bills, get paid, and then see that we are being paid according to contract. I mean, I represent a group of physicians that are both medical educators, but also in the front lines of delivering care in Dayton. Our faculty are all the trauma and burn surgeons. They do a lot of, they support a lot of the residency training programs that treat the underserved. A large proportion of our patients are Medicaid, and I think right now we're at 10% of our bills are never going to get paid because people are uninsured. And we're happy to accept that burden. I mean, we don't really see it as a burden. We see it as a commitment to being physicians. But for people that theoretically have insurance, we spend an enormous amount of time and effort getting paid according to contract, and it's almost like it's like battling spammers. I mean, they have, you know, these machines.
It is a live webcast, so I guess that's a good comparison.
I mean, like, you know, we figure out, no, you agreed you were going to pay us this, and we've figured out that you aren't, and so then they figure out a new way to not pay us. It's really like this
this chess game.
Yeah, exactly.
With lives.
You find that you spend more time worrying about being paid than actually taking care of your patients.
Part of what I'm doing in my administration, I'm trying to take on that burden for my colleagues so they can spend more time taking care of patients and not being worried about it. I like them to think that I'm worrying about it on a lot of people's behalf. And when I'm personally seeing patients, no, I try to completely put it out of my mind. But when I'm not seeing patients and I'm in my office with my staff, yes, I'm spending all my time worrying about how we are going to keep everybody paid and keep the doors open.
Since we have two doctors here, let me ask you both about the aspect of malpractice insurance. It came up a lot during the recent presidential campaign. It has been rising astronomically of late. How does that fit into this whole discussion, and how does it impact you?
We have to have tort reform. That's no doubt about it. Everyone agrees on that. But the question is what sort of aspect of tort reform is necessary. For example, award caps don't do anything, actually, in states such as Texas and California. They have not been demonstrated to show that the insurance premium has decreased because of that. What we need to work on is essentially how to make people practice medicine in a less defensive fashion. So defensive medicine is rampant, essentially. And so
it's an interesting term.
And that tremendously put a burden on the cost of healthcare. Things that we can do, for example, with better coordination of care, the institution of the technology in the medical records, for example, is very important because you eliminate medical errors, like the EPIC system that was instituted at Children's Hospital just last week, and the formation of things such as comparative effectiveness research that makes it so that we go by certain guidelines and certain things that make sense, and rather than just doing things that according to your gut, for example. Yeah. It doesn't work that way in medicine.
And Dr. Dunn has a response to that.
Yeah, and I agree. I'm a general surgeon by training, and so I completely agree with Don about the impact of defensive medicine in this country and the need for tort reform. However, I think Ohio is really a great example, like Texas, like California, of a state where caps have definitely decreased malpractice costs. In Ohio, the total bill for malpractice for my group is now $1.4 million. So it's not a trivial expense, but that number represents a decrease over the past 5 years. And that decrease can be timed to the institution of caps in Ohio. And just anecdotally, my parents live in Florida, and my former residents that are practicing general surgeons in Florida, which has a very large problem with being a difficult malpractice climate for physicians. Premiums there for surgeons are 5 times more than they are in Dayton. And people are practicing very defensive medicine. Hence, my parents are constantly calling me up saying, do I need this CAT scan? I just had one 6 months ago. Do I need this DEXA scan? And my parents have very good physicians that over the years I have met, and they are trying to practice very good medicine conscientiously. And they're not doing anything differently for my parents and their other patients, but it's a reality. You're practicing in Florida. You're paying 5 times the premium you would in Ohio. Wow. There's no way that can't impact your day-to-day decisions about, well, do I need this image? Do I need this test just to be absolutely sure? So when a lawyer calls me up to challenge this care, I have done everything.
The evidence that I need. Yes.
And yet a few years ago, the Southwest Ohio area was losing its doctors because of that.
I don't mean to say that the limiting of the award cap does not impact whatsoever the insurance premium. But there are many other things that we can do.
You're absolutely right.
For example, the formation of the program at the University of Michigan, for example, the disclosure and offer program, where physicians very, very early on admit their errors and their unanticipated outcome in these cases, and then the family is less likely to sue. And so, for example, they've demonstrated the number of lawsuits have decreased by 50%. And not only that, the litigation cost has also been brought down under control.
That's exactly right.
Because doctors admit their mistakes early on?
Yes. Of course, yes.
All right, all good insights. We thank you both, Dr.
Absolutely.
Margaret Dunn, Dr. Don Wynn. Great insights. Nice job. Kenan, how you doing over there?
We're doing just fine over here, and there's some great insight going on at the blog right now. WDTN.com is the place to go. We have a comment from a guest who says, "We are not saying reform is needed. We are saying do what will help instead of being bullies on the playground and taking all of the toys home with you. Why not tort reform and buying over state lines?" We have another comment from somebody. Brad Ditzel, where in the Constitution does it state the federal government is concerned with health care? We have another comment from Renee. People need to pay. They will shop around. Costs will come down, especially the doctors didn't have to wait 6 weeks to get paid. We have another comment from Rose. Yeah, for no or lower lawsuits, I think it is something that has done a lot of disrupt and destroy a lot of programs in America. And I also went to our Facebook page, and Cynthia Meeslow is asking, don't you find it ironic that health care and the discussion of health care is making us all sick? And Xenia Ames writes in, is it true that you will be fine if you don't have health care insurance? What happens if the person is unemployed? Mark and Marcia.
Thanks so much, Kenneth. Well, from doctors to hospitals, as we continue to delve into healthcare reform, joining me now is Brian Bucklew from the Greater Dayton Area Hospital Association, David Kinsaw, CEO of Dayton Children's Medical Center, and Frank Perez, CEO of the Kettering Medical Center Network. Thanks, all of you, for coming in. You heard the doctors and the healthcare companies, health insurance companies. What is your thought, Brian? We'll start with Brian as to what they were saying.
Well, I think the part of the challenge is that I think sometimes universal coverage and making sure everybody has insurance has become a synonym for healthcare reform, when healthcare reform encompasses so many other things. We heard a little bit about tort reform and the way the delivery system is taking place in our region, in our country. And I think that if you have a system that you believe is inefficient and ineffective, covering more people in that inefficient, ineffective system isn't going to get you a better healthcare system. And it's a very complicated issue, as you're hearing today. And my concern is when politicians start talking about passing something instead of passing something that makes sense and is the benefit for everybody, that causes us some concerns that we're going to pass something that may not be well thought out and have some negative impacts for our region. And we're a very different region than many of our neighboring cities in the state of Ohio. We don't have a university hospital. We don't have a public hospital. So our not-for-profit hospitals are really the safety net for the entire region and poses some significant challenges that a lot of other regions don't have, and we need to make sure that our voice is heard, both in Columbus and in Washington, about that.
So, Mr. Kinsel, would your concern be that the government is providing too much input?
I agree with Brian to a large degree in terms of I think people are concerned about what the public option may look like, or what health reform may look like. For example, private health insurance pays doctors and hospitals about 20 to 30% more than Medicare. And then Medicare pays doctors and hospitals about 30% more than Medicaid. And doctors and hospitals lose money taking care of Medicaid patients. And so it depends on what form that it takes. And that's one of the things that scares us, because you'll hear politicians talk about coverage and access as if they're interchangeable, and they're really not. Coverage means that people have an insurance policy. Access means they can use that, they can go somewhere and people will welcome them and they will get the care. And that's one of the problems that we have with the Medicaid program, because they lose so much money on Medicaid. All doctors that I know take Medicaid, but they limit it to a certain number within their practice so they don't lose money. So to give you an example, Ohio expanded Medicaid coverage for the state children's health insurance program, but without putting any more money into the program. They have a card that says they have coverage, but they end up in our emergency department which is not the right care at the right place at the right time, which is the secret to good health care.
So the real issue is access. Is that right, Mr. Perez?
And access is going to be determined by basically fundamentally two factors. Are physicians going to be paid fairly under any system so that they can, in fact, continue to receive those patients openly and willingly? And what we have seen, as Dave was mentioning, is that if rates are set far off Washington or someplace else for a public option, there's no guarantee that they'll be relevant to the cost that the physicians or the hospitals are experiencing. I always am amazed that we, for example, as an adult hospital, we are told by Medicare about 3 months before the year starts how much we are going to be paid for every patient that comes through our doors 15 months later. And irrespective of anything that happens in the interim, in terms of the economy, of energy changes, cost of energy. So it's exactly what my peers, my colleagues have said. The concern is not about whether we're willing to. We believe that universal coverage it's worth the effort.
Certainly.
The question is, how do we get there? How do we get there to make sure that there are reforms in place that support better access and better cost control as we go forward?
Well, then what ideas do the three of you have for hospitals helping to control those costs, Brian?
Well, I think, not having to do as much cost shifting, and I think that's a major issue where people don't see the true cost of health care because they either have insurance or they're on a public plan that they don't have to pay for. So nobody really sees the true cost of what insurance is, and that makes it very difficult to have a rational argument about health care reform. But the other is making sure we have the right type of care available for our community and for our country. And right now we don't have the right type of care. We have some of the busiest emergency rooms in the state of Ohio right here in the Miami Valley area. And getting people out of the emergency room into the right type of care is a big challenge. It's a challenge we're working on day to day with a lot of our partners in the community. I think that access issue is the big challenge, and more so than the coverage issue. And I think we can come to some sort of agreement on how to cover people, but if you have that government option, basically what we're saying is you're going to have the government, which makes the rules, and be the referee of the system, also be a player in that system. And, right now, hospitals, doctors, other medical providers that are involved in the public option are not doing well and not covering those costs. I mean, those are the issues that we have. The people at the end user of Medicaid and Medicare are happy with the services that they provide, but they don't have to pay for that cost, and it is losing money.
And Medicare doctors are facing a 21% decrease in 2010, so there's another issue there. Right? Another issue. Okay, gentlemen, thank you so very much. I'm going to send it over to Kenan and see what the viewers are saying now.
All right, Marsha, thank you. Our live chat is really heating up. And let me throw some coals in the fire for you. I have a Time magazine article about the youth, and are they invincible? And the article says they are less likely to be offered employee-based coverage, earn less money to buy insurance on their own, and they're generally healthy and spend little time worrying about their health. Americans ages 19 to 29, or 1 in 3, lack coverage. This is part of what the Time magazine article is saying. It says, although young adults as a group are healthier than older Americans, they are far from immune from diseases, sickness, healthcare expenditures. An August report from Commonwealth Fund stated that 15% of adults ages 18 to 29 suffer from arthritis, asthma, cancer, diabetes, heart disease, and hypertension, and more than half are overweight. They also end up being injured quite often. 24% of Americans ages 18 to 29 visited an emergency department in 2008, according to the fund. So we know that this healthcare debate is a big issue when it comes to the youth. We want to get them involved. Come to WDTN.com for that. I want to go to the blogs real fast. We got one person, Steve says, I watch on C-SPAN the U.S. House Oversight Committee talking to 8 healthcare companies. Why are they talking so much? Example, United Healthcare only puts 57% of their money into patient care. This is one of the biggest companies. Blue Cross Blue Shield is a close second. They are what kind of profits they're making. Why can't we get into the state of an insurance company and get better coverage at lower costs? Mark and Marsha, we want to send this issue right back to you.
All right, we'll take it. We'll take the hot potato back over here, Ken, and thank you very much. He talked about some of the younger demographic. There's also no question, I think, in this that one of the key battlegrounds regarding health care reform are senior citizens, I guess would be the term. My mom just turned 83, and she and I, when we talk, we're always talking about health and doctors and this test and that test. I mean, that's what it's all about.
I tell you, Mark, the real wake-up call for me is when I turned 50 and I started getting my first issue of AARP. So, you don't have to be 83. We're talking over 50 here, and that's a lot of people. In a minute, two members of AARP. First, a pair of commercials, though, that will illustrate to you why so many people over the age of 50 are so interested in this particular debate.
Special interest groups are trying to block progress on health care reform, derailing the debate with myths and scare tactics, desperately trying to stop you from discovering that reform won't ration care. You and your doctor will always decide the best treatment for you. Tell Congress not to let myths get in the way of fixing what's broken with health care. Learn the facts at healthactionnow.org.
Seniors have sacrificed, surviving the Great Depression, landing at Normandy on D-Day, raising strong families, and protecting our freedom in a dangerous world. Now, in their most vulnerable period, seniors are being asked to sacrifice again. Congress plans to pay for health care reform by cutting $500 billion from Medicare. For seniors, this will mean long waits for care, cuts to MRIs, CAT scans, and other vital tests. Seniors may lose their own doctors. The government, not doctors, will decide if older patients are worth the cost. And the cruel joke here is that many of our politicians are designing a health care plan for the country that they don't want to apply to themselves. So Congress could get better health care than the rest of us. Tell Congress, don't pay for health care reform on the backs of our seniors. They've sacrificed enough.
Of course, we're seeing those spots already airing now on, local stations, the networks, and they certainly have an impact. Joining us now live, Kathy Keller and Sanford Holmes, who represent AARP. Very glad to have you both with us here today. Thank you.
Now, those two commercials certainly give us the idea of both sides, all the sides of this debate, because there's more than just two sides, obviously. Tell us what you think of the themes that you saw here in these commercials.
AARP is fighting for its members, and we do want to protect Medicare and the benefits that our members have earned, the Medicare benefits that they have earned during their working lives. We want to make sure that when people retire, they will be able to get affordable health care. We want people from the ages of 50 to 64, the pre-Medicare group, also to be able to get affordable insurance. That means that we don't want companies to be able to discriminate against our members with unaffordable premiums for people based on age or pre-existing conditions.
And we saw something with that with General Motors. I know what's happening with those retirees that are under the age of 65, and there's another set of rules for those who are over the age of 65.
Correct. It's hard.
Sanford, you've been out there at some of these town halls, talking to these people face-to-face, hearing their concerns. What are some of the concerns you're hearing? And I know from some of the older folks, they get very concerned when they start hearing about the possibility of death panels, quote unquote, and whatever the new system is going to at some point decide who lives and who dies. I mean, that's scary stuff.
Yes, it is scary stuff, but for the most part, it's misleading stuff. There's nothing in any of the proposals that talks about death panels, as we have seen over the summer, particularly August. But I think the seniors are right to be concerned about how their benefits are going to be affected, and that's what we're here for, to protect their benefits and make sure that there's no erosion to their established benefits. And we're going to be fighting hard to make sure that those who fall in that 50 to 64 category get some help, some subsidies, and adjust the ratio of how much they're charged based on age or their health conditions by insurance companies. So I think a lot of that is a lot of misinformation about what's in those proposals, and they were just not true.
Yeah, a lot of the truth is a very valuable commodity at this point in the discussion. Of course, one of the other big questions is how are we going to pay for all this, no matter what final form it takes. The President has said he will fund reform at some point by using savings derived from Medicare funds. Let's hear what Dayton Congressman Mike Turner says about that concept.
I think the biggest area of concern for seniors comes from the fact that all of the plans that are being circulated result in money being taken directly from Medicare. The prominent bill in the House, it's $500 billion from Medicare, 120 plus from Medicare Advantage. And everyone knows this is a plan that is headed toward insolvency. Well, you can't take money from a plan or a program that is headed toward insolvency and have it have more money. So there's only going to be an opportunity for reducing services in order to make up those costs, to make up the losses from the monies that are being taken. I think that's what really concerns most people, is that they know that Medicare is going to have reduced resources, and that has got to mean reduced care for our seniors.
And that is a big red flag for the folks, you guys represent. What are your thoughts on that aspect of this?
AARP believes that we must reduce the waste and eliminate the waste in Medicare. We know that in order to make sure that seniors get the benefits that they've been promised, that we have to eliminate that waste. About $500 billion can come out of the plan, because we know that that currently Medicare hands out billions of dollars in subsidies to private insurance companies, and those are tax dollars that need to go to patients' care and not insurance company subsidies. And we believe that by eliminating that waste, we can protect the senior benefits and fill some of the gaps in Medicare.
Sanford, your thoughts on that or anything else?
Yeah, I think the Medicare Advantage is probably misunderstood by many. There's a great deal of extra monies are being paid just to insurance companies that doesn't do anything to improve health care for the consumers. So we want to make sure that that money is channeled in the right direction to improve health care overall. And that's just not happening. Of course, there's going to be some more HIT requirements going to come along. It's going to result in some savings and stop some readmissions that happen, transitions from the hospitals to nursing homes. Sometimes we need to make sure that there's a set procedure to make sure people are not readmitted back to hospitals because of the procedures are not careful. And so those are savings in those regards. But mostly, a great deal will come out with the excess that we're paying for the subsidies to the insurance company that adds nothing to the care of the patients, in this case, the beneficiaries.
All right. The folks who are 50 plus will certainly play a big role in this, as Marcia and I well know.
That's for sure.
Kathy Keller, Sanford Holmes of AARP. I'll send it over to the youngster over here, Ken Oliphant.
Yeah, I don't have to worry about AARP just yet. Thanks, Mark. Well, please keep those emails and comments coming about our webcast. Head to WDTN.com. If you have something to say, send it now. WDTN.com is the place that we want to hear it. Lawmakers, doctors, insurance workers, grassroots activists, they're all here right now. They're ready to answer your questions. Take part in our live blogs there right now. Let me read some feedback we are getting, because this is coming fast and furious. Sheila Gatling says, why not have Medicare open for everyone? Anthony Weiner, Democrat out of New York, has proposed this question on several cable network news shows. What value does this have on our system and our healthcare companies? 4% overhead of Medicare. If you're not bringing value to the transaction, you're stealing, according to Dylan Radigan of MSNBC. And she says she can agree there. Also, from my Turn to Two email box, Cameron says, I travel to Germany quite frequently on business. Their quality of care is far more superior than in the U.S., and the doctors there spend a lot of time with each patient, asking a lot of questions and spending time with all those patients. So, Mark and Marcia, that's a very good point Cameron has made.
Interesting, too, watching, it's not only people submitting questions to us, it's people kind of debating themselves online live. It's kind of an interesting concept as well. Thanks,
that's interesting when he talked about how countries outside the United States, those westernized countries, have better healthcare systems. It is the opinion of many, and that they spend less money per person on healthcare coverage, as we spend about $80, $100 on every person, and they don't spend nearly that much. So. Healthcare reform is also a key issue for companies that help our impoverished citizens.
Joining us now, Janet Grant. She is from CareSource. Janet is the Executive Vice President of Business Development and Regulatory Affairs. For those of you who may not know, CareSource is a nonprofit health plan that serves 770,000 Medicaid consumers in Ohio and Michigan. So more than 750,000 people. That is a huge chunk of folks. We thank you for joining us.
Thank you. How can reform, how can that help your company?
Well, from our perspective, the really important thing in reform is covering all individuals. As you said, we've got a 20-year history of providing care for the underserved, primarily the Medicaid consumer, and we know that there are many individuals that just don't qualify for Medicaid for various technical kinds of reasons and can benefit from health care and the kinds of services that a company like CareSource provides.
When you hear from clients on an individual basis, and I'm sure you're hearing from them a lot these days, what are you hearing? What are their concerns? What are their top-of-mind concerns?
Well, I think the concern of many consumers is, what does healthcare reform mean for me? And does it mean that I'll be able to continue the kind of coverage that I have now? For those that don't have coverage, does it mean I'll be able to access coverage and have coverage and access to healthcare? Those are the really important things from a consumer perspective. We cover a lot of children on our plan, and so for them, their parents don't have coverage. Many of them don't have coverage. So we believe that's a great opportunity with healthcare reform, is to cover the entire family.
This is interesting. I mean, it's a massive issue, but yet it affects individuals. Ultimately, it comes down to that single individual.
When the idea was first introduced in the 90s, it was because there was concern about our health care coverage. Now it has gone to critical urgency. So if there is no reform, how will that affect CareSource?
Well, CareSource will continue with its current mission in terms of the Medicaid program. I think for everyone in healthcare, this is a once-in-a-20-year lifetime kind of opportunity. And if we miss it this time, it's going to be a long time before kind of the stars all align for a country to deal with a big issue like this. So we would see it as really a lost opportunity.
Janet Grant from CareSource, thanks so much for being with us and the explanations.
Thank you very much.
We appreciate it.
Let us now kind of move this webcast in a different direction, healthcare reform and business. The President set the stage for this key element when he came to Ohio 2 weeks ago, and Steve Handelsman was there as Mr. Obama rallied labor.
President Obama went to the Chevy Cobalt plant in Lordstown, Ohio, where 1,000 workers are being called back from layoffs.
We're not turning back. We're moving forward.
At a speech to the AFL-CIO in Pittsburgh that felt like a rally for health care reform, the president said rising medical costs are pushing down the economy and workers' wages.
It's the fault of a broken health care system that's sucking up all the money. When are we going to stop it? When are we going to say enough is enough? How many more workers have to lose their coverage? How much longer are we going to have to wait? It can't wait.
Back in Washington, Republicans said we can't rush.
The American people are concerned about the costly government takeover of our health care system.
They do not want the federal government taking over their personal decisions about their health care.
But President Obama...
I got a question for you. Are you fired up? Are you ready to go?
...is turning up the heat.
Are you ready to go?
Reviving last year's winning campaign style. I'm Steve Handelsman, NBC News, Washington.
Yeah, the emotion is certainly there. And joining us now to discuss the business impact of all these various health care reform proposals, to my right and your left, Phil Parker, President of the Dayton Area Chamber of Commerce, and over on that end, Wes Wells, of course, President of the Dayton-Miami Valley AFL-CIO.
All right, thanks both of you for being here. Good to see both of you. We're going to start with the basics. Where do you stand? We'll start with you, Phil Parker.
Well, we've been talking about this here for an hour, and we know how complex this issue is. We believe that there has to be reform. You know, the business community understands that we cannot sustain the cost of health care, providing it for our employees at this rate.
It's gone up 100% in 10 years.
That's right. So we know, we support reform. We know that there has to be a lowering of cost, but this is a very complex issue that there's so many facets that are involved in this thing that some of it is unintended consequences that we're not yet sure of what will happen with some of these bills.
Mm-hmm. Wes?
I think there has to be reform, and there have to be a way to bring insurance costs down. And the only way that we see is a public option. There has to be some controls put on the CEOs. For United Healthcare, for example, Stephen Hemsley, 2000 compensation was $13.2 million. Cigna CEO Edward Hemsley, 2008 was $120.51 million. This completely out of line.
We've got some more numbers we can look at right now. I think we've got a graphic that kind of shows this. It shows the three primary plans and how each affects business. First, the Baucus bill currently being debated in Washington. The price tag anywhere from $774 to $856 billion. Employers with more than 50 employees who do not offer health insurance would be required to pay up to $400 per full-time employee. There would be a 35% excise tax on high-priced health insurance plans, the so-called Cadillac plans you've heard referred to. The other Senate bill, estimated to cost $645 billion, also mandates that employers provide health coverage, mandatory, 60% of family premiums, or face a penalty of $750 for each employee not covered. Then there's the House bill. That price tag right around $1 trillion with a T. Employers must pay 65% of family premiums or pay penalties, although some small businesses would be exempt in this case. And in each case, there are fees and surtaxes, even penalties, levied on some businesses. So some things in common, some differences. Your thoughts on all that?
Well, you know, the Congressional Budget Office has been talking about this ever since the very get-go. And its executive director has been saying that this is going to cost the American taxpayer a lot more than people realize. And one of our concerns from a business community aspect is it cannot continue to drive up this deficit. This is going to have to be something. The president said that this is not going to cost the American public anything, and that's not true. I just don't believe that it's going to be without some type of cost, either to the employers or the employees or those that want health care insurance. The cost is going to have to be spread across everyone that has access to health care.
You know, we're losing from 18 to 50,000 people a year estimated because they can't afford health care insurance in this country. That is disgraceful. When other countries have national health care.
I'm glad you're here because I want to ask you, we've got a great, local example of this right now. All these, the GM folks who are now, without work, all the Delphi folks, a lot of people out there right now say, I worked all my life with the understanding that I would be taken care of in my old age, and it's looking now like it's not going to happen. I mean, that's a tough spot for those
tragedy.
Folks.
This is a absolute tragedy what happened to General Motors and at Chrysler. Chrysler's in better shape. Their benefits are than what General Motors is, but for a person to work all their life and then have their benefits taken away, almost all of them, that's not fair.
We know that in this recession, there's going to be job losses and have been. And I don't want to take the focus off of that because we know there's job losses. We know that there are people that need health care coverage. And quite frankly, we support that. We want folks to have access to health care. But the key is, I think we have to understand that we are in one of the toughest economies. This cannot be shared. The burden cannot be placed only on the business community. I don't agree with the public option piece. You had your hospital folks here just a few minutes ago saying, look at what Medicare and Medicaid pays hospitals. If we let the government run a program like this, the hospitals will be put out of business. This is not the answer. There has to be more thought. There's 500 amendments or more already that are in the Senate bill right now. This is going to be a long debate, and I think that we just have to have our heads together. We have some specific tenets, what the business community thinks we should stand for this thing, and that's where we're going to place our position.
Well, Phil, since you are in charge of our local Chamber of Commerce, we're going to show you some numbers that gives the 5 points for health care reform proposed by the U.S. Chamber of Commerce. For instance, expanded access to care, health information technology, promoting widespread adoption of interoperable health, including electronic prescriptions and medical records, prevention and wellness, incentivizing individuals and businesses through tax credits to healthier lifestyles. Now, consumer-focused health care. Congress should make account-based plans more attractive to those small businesses by increasing flexibility and improving the transparency of cost and quality data so that all Americans can shop smart for the best care. Medical liability reform. Ensure fair damage awards, eliminate frivolous lawsuits, and lower the cost of health care in the U.S.
Do you like that list?
Well, I like that list. As a matter of fact, we have 12 on our list, and 4 are right up front on our list of that. We think that there are options to lower costs. We think there are options on how to get more people insured, and we want that. But I will say to you again, a public option, a single-payer system, is not the route to go in America.
Right. We disagree.
From the union point of view, what do you
want? Public option.
Public option, absolutely.
And
why? Very simple. Better access. And it puts competition into play.
And that's what we talked about earlier with the doctors in terms of access. There's coverage. There's one issue. Access is another one of the major issues with that.
Right.
Because you're looking out for your members.
Yeah, that's right.
All right. Wes Wells, Phil Parker, always a pleasure.
Thanks, both
Good to
of
see
you.
you. Thanks for making time for us. Kennan, how you doing over there?
We're doing well, Mark. In fact, I got an article from the Wall Street Journal where they were talking, John Cochran. The article says what to do about pre-existing conditions, and one thing he says in here, healthcare and insurance are service-oriented retail businesses. There's only one way to reduce costs in such a business: intense competition for every customer. Let's head now to the blogs, where one person, Joanne, says the AARP people were correct, but could say it more plainly. Proposed healthcare reform would decrease Medicare spending without cutting patient benefits. It would cut wasted money that goes into insurance companies by moving Medicare patients from Medicare Advantage to regular Medicare. Medicare Advantage is only an advantage to the insurance companies. And went ahead to my tweet deck and Twitter, where one person says, if there's so much money in waste, let us start by eliminating this waste. The story is waste, and it's a shell game. So people are blogging fast and furious. WDTN.com is the place to go. It's the place to be for this healthcare debate. We want to send it right back over to Mark and Marcia. Thank you.
Our laptop's been cooking here the whole time, and obviously we're going well past the hour we'd planned, but that's one of the beauties of the Internet. We don't have that hard out time that we have on the air. Joined now by Rob Scott with the Dayton Tea Party, and Greg Schultz is next to me with Organizing for America. We thank both of you gentlemen for coming in. Why don't we start by just maybe letting the folks out there get a better understanding. Maybe we'll start with you on just your basic stance, your basic position regarding healthcare reform.
The Dayton Tea Party, essentially, we're a nonpartisan group. We're made up of Democrats, Republicans, Independents, Libertarians, all across the gamut, homemakers, mom and dads, small business owners in the Dayton community. The thing that concerns my organization the most is the cost. President Obama and the Congress has said that we're going to pay for it through savings and finding waste. Well, if that's the case, why are they not doing that now? I mean, why are they not going after those savings now and finding that waste? If that's the case, then they owe the American citizens an apology for not doing that already. Additionally, we feel that there's other alternatives out there that can be brought forth, such as tort reform, such as portability. These issues are not in the current bills. They haven't been addressed, and these are the things that I'm hearing from my membership.
Okay, Greg Schultz with Organizing for America, your position would be what?
Yeah, thank you. On that, Organizing for America is a national organization. It's a grassroots-oriented, bent on supporting President Obama's agenda. And we're very supportive of the Obama plan, which focuses on three main areas. It's providing security and stability to those that already have health care insurance, and it's providing quality and affordable coverage to those that don't have insurance, and then lowering costs for small businesses, large corporations, Ohio families, and government. And so we're doing everything we can to make sure that the real stories with real people across the Miami Valley and Ohio are being heard by members of Congress.
Well, gentlemen, this has become such a squabble. What happens if nothing happens?
Because that's the history. I mean, we tried this many times.
We tried it in '93, and it just kind of crashed and burned, and then now it has arisen. And the problem is now is that it is critical. There's really no longer a real option here. Something has to be done. So, but what happens if nothing is done? Because there's just too much arguing about it.
If a consensus just isn't there.
Right. If a consensus isn't there, they just need to go back to the drawing board. We will be the first ones to admit, the Dayton Tea Party folks, to say that there are problems in the system. There are people that slip through the cracks. Our healthcare costs are rising, but we need to look at why they are rising. Are they rising because of these frivolous lawsuits? Are they rising because we are basically having many monopolies within health insurance companies? Currently, from the doctors that I've spoken to, there's only really 6 healthcare companies in the Dayton community. Why not open it up to the 1,300 that are across the United States? Let the free market work. So I think if nothing happens, let's go back to the drawing board. Let's get something done.
Well, can be seen as a vicious cycle because the costs are rising because people aren't covered and they're using emergency rooms, and it just keeps going around and around until something has to stop it, cut in, and do something about it. It is the uninsured that certainly are providing these high costs.
Yeah, well, if nothing happens, more people will lose their homes, more small businesses will close down, more people will be laid off from large corporations, people will die. And there people are, without access to quality, affordable health care, people's lives are suffering. Last 10 years alone, a report just came out yesterday that premiums raised 108% in Ohio over 10 years and wages 40%. So we're already in a catastrophic situation for many Dayton area families and businesses. So the status quo is unacceptable, and inaction is not an option.
You back the Obama agenda. You said that clearly. The big question, the critics that he's hearing from critics is how is he going to pay for this? He talks about possibly diverting money from Medicare and Medicaid. That alarms some of the older folks. How are we going to pay for this? How are we going to make this float?
And first, the President has stated that no money will be taken out of the Medicare Trust Fund. So any seniors will not lose any of their existing benefits. And the President is a strong believer.
Future money.
Yeah, and I'm not sure of that specific.
Okay. Okay.
And that the President believes that the money is out there. There's a lot of waste, abuse, and a good deal of fraud in the current health insurance system. And that by increasing competition, things like a public option, by focusing on health care prevention, which I don't think we've talked enough about today, those are just two major factors, competition and prevention, that can really start to drive down the cost of health insurance for families, businesses, and government.
Rob, any middle ground found here at all?
I would like to stress the cost of it. In 1968, when the Congress wanted to take up Medicare Part B is the component that pays physicians and therapists. They predicted in 1990 that the cost would be $12 billion. The actual cost, $110 billion. As somebody that is 27, that is going to be beginning their career as an attorney, I graduated this year from the University of Dayton School of Law, that somebody is going to be beginning their career, I don't want to be left with a check. I mean, this is an enormous program. The costs are astronomical. Why are we not going after the things that are rising the cost of health care, like tort reform or frivolous lawsuits? Or why are we not addressing portability, opening up markets to lower the costs? I mean, these are the things that are of large concern of people of my generation.
And it should be, because you get the bill.
Yep. Well, I'd say increased competition will help drive down those costs, which is why I think in the President's plan there is a public option. So I agree that competition will be healthy.
All right. Rob Scott, Greg Schultz, we thank you very much.
Good
perspective.
Thank you, guys.
Kenan, one last time to you and the viewers. What's percolating over there?
Yeah, we got two viewer comments. This one about unions. One from Ann. She says the union official is right that there must be a public option. The Baucus and other bills have an individual mandate which requires individuals to be insured. A mandate with no public option is simply a gift to insurance companies by giving them lots more captive customers. And then from Wayne, who has a competing opinion about this, says the unions protect underperforming workers. They should be working with management to make the companies as profitable as possible so companies will not want to move to less developed countries. You know, we want to thank you for blogging with us here on WDTN.com. You have a lot of great comments out there. We want you to keep this going even after this webcast is finished. We need this debate so everybody gets the most important and the latest information. And, of course, WDTN will be here every step of the way. Mark and Marsha, right back to you.
All right, Kenan. Thanks so much. Good job over there.
And that's a good point. That's one of the beauties of the Internet and the website. We can keep this going, 24/7. It doesn't end.
And it's good to hear what people are thinking, what
it is.
viewers are thinking, because those
so often
folks...
it's a one-way street.
Right.
It's often us talking to you, but this
Right.
allows you to talk to us and get involved. So this has been great. We've been at this for about an hour and 15 minutes now. Covered a lot of ground, but in many ways just kind of scratched the surface. And the debate obviously will continue in Washington and here in the Miami Valley as well. We thank you very much for joining us for this exclusive webcast. Hope you learned something about a very important issue that will affect us all at some point.
We have certainly learned sitting here, that's for sure. Of course, 2 News is on your side to continue coverage of health care reform on WDTN.com.